A-list actress made a surprise announcement this week. Christina Applegate recently had her ovaries and fallopian tubes removed in an extreme effort to avoid another cancer diagnosis. Here to help us understand more is Dr. Jessica Shepard. Good morning and welcome.
Good morning.
Thank you for being here.
Yeah, absolutely.
Okay, so you have to help. It is really important. You have to help us shed some light on this because I don't fully understand it all. So what went into Christina's decision?
You know, that was a big decision for her. For someone her age, she's 44, you know, looking into long-term, you know, she has a lot of her life to live, and what she did was remove her ovaries and fallopian tubes. But in the past, if you remember, she actually had her double mastectomy as well because she was diagnosed with breast cancer.
Right.
So the decision came because she had genetic testing, which she found out that she was BRCA1 positive, or she had the BRCA1 gene rather. So it's not that it's called the breast cancer gene,
right.
The breast cancer gene. But what she found out is having that genetic predisposition increased her chances, one, of having breast cancer, so she dealt with that, but also having ovarian cancer, which is very rare. If you look at the general population, 1.4% of women will have ovarian cancer. But when you have that BRCA gene mutation, it increases your chances to BRCA1 40% and then at BRCA2 10%. And ovarian cancer is actually pretty bad because you don't recognize that you have it till it's very late stage. And then when you find out that it's there, chances of living are very, very low.
So now, is this, she had BRCA1.
Yeah. So
women that don't have BRCA1, would they ever make this sort of decision, or is it only if you have that genetic predisposition?
It really is that genetic predisposition. So having BRCA gene mutation is very rare. Okay. But when you do have it, then you do need to get genetic testing. So the thing with that is that you need to know, why would I go genetic testing? So there are various cases in which you would. So if you have a family member that's been diagnosed with bilateral breast cancer, so both breasts, or have multiple recurrences of breast cancer, also have ovarian and breast cancer at the same time, that's an indication, as well as if you're a part of a Jewish community or a Jewish ethnicity, that's a reason to get tested as well. But we don't test in childhood, we test in your 20s into your 30s, because you really do need to make decisions, hard decisions, when you find out that you have that gene mutation. But there's no way to prevent it in a child, so we wouldn't do anything if we found out that you did have BRCA1 or BRCA2. Okay,
so, and you said 20s or 30s, and that's the time that many women are thinking about childbearing.
I know.
So what goes into that and the genetic risk?
Yeah, so you have to decide between your doctor and yourself. That's where the relationship comes in. You know, what is my risk? What can we do to help prevent? What can we do to screen and make sure? So obviously you'll go through more screening, more ultrasounds. For breast, you'll go through more mammography and also have more MRIs earlier than what women usually have. And then you have that decision, when should I take my ovaries? If I want to take my ovaries, and also talking about menopause. I think that's the other discussion too. Once you remove your ovaries, you're in menopause. So she has to deal with that as well now. So big decisions.
Those are big, big decisions. Yeah. Wow. Have you dealt with patients who have this?
I have. They come to my office and they have a family history of having BRCA gene mutation. And the question is, should I go get tested? And that's where the discussion starts. Where are you in your life? How old are you? Are you finished childbearing? Do you want children in the future? Are you done with childbearing? So these are the questions that we go through. But most of the time we do say go get testing so that you can have an even better discussion knowing if you are, again, exposed or have the BRCA gene mutation 1 or 2.
Right, because a lot must go into that decision, especially if you're in your 20s. Do you want to know? Do you not? Because it could potentially change the course of your decision making.
Oh yeah, how about your life?
Yeah.
You're like, what do I do with big decisions in my life, whether it's having a major surgery, whether it's taking some medications that can be very hard to take, and also childbearing.
Right, like do I want to find a mate earlier?
Right.
I guess it's probably good to know.
Yeah, it is good to know. Good information so that you can further your discussion, make educated decisions, and then talk to your doctor.
Information is always good.
It is.
Thank you so much, Dr.
welcome.
Jessica. And so if you guys want to hear more about BRCA1 or anything for women's health, head to Dr. Jessica's website, viewpoint.com.